these are a tool, right? And just like anything else, tools can be very useful or they can be used inappropriately. And so one of the things that I think about is, one, does the use of these medications lower your overall risk of something bad happening from your health, right? So if these
Mhm.
lower that, you lower your risk of a cardiovascular event, cancer, diabetes, etc. So I think in that aspect, if you utilize them and in 3 months you lose 10% of your body weight, or 6 months you lose 10% of your body weight, well, now you've substantially reduced every day you wake up, your risk accumulation is lower. So I think that's an important point. Two, how do you think about these in the use of, like, okay, what are the potential side effects? What is the risk of an adverse event or a serious adverse event? How do you kind of personally, manage that risk, right? Um, and then it's okay, how do I think about these in terms of short-term use versus long-term use? So I think everybody should take this as a personal decision, right? I think there's a lot of people who would really benefit from these. Sometimes people shouldn't be taking them, right? I think and even in those people who I think maybe, hey, this is probably not the best idea, I think it's still your choice, right? And is the risk reward for you, does it make sense? And I think from our perspective as coaches, is how do we best support you regardless of whether you decide to take them or not, right? Our
Into that
perspective,
next.
to be totally honest, from our perspective, I mean, these make our job easier and more effective, right? If we can reduce some of the battles that our clients have to have, and we can focus on, okay, well, now that we've taken care of some of this stuff, whether it's through medication or whatever, like if we can focus on, okay, now that you're feeling better and you're moving better, let's make sure you can,
Yeah,
let's
let's
really
work on
exercise,
this.
let's engage. Hey, here's, like, while your brain isn't craving all of these things, let's work on,
Mhm.
okay, here's menus, here's things you can build, here's how you can shop. Like, it's just a piece of the puzzle. It's not good, it's not bad. There's no moral judgment on it. It's like, okay, these are the things on the ground. This is the facts of the case.
And like we talked about, and like Brad said, they're a tool, and they're in and of themselves they're neutral, right? It's like it's what you do around them that sort of matters more, right?